And we have been reporting that the CDC has confirmed 2 new cases of the Wuhan coronavirus. These are in the Houston area.
A man and a woman in Northwest Harris County tested positive for COVID-19. Health officials in Houston are about to speak about that. This is a live picture from there in Houston. Those cases bring the total number in Texas to 3 now, and that does not include people who were evacuated from overseas and stayed at San Antonio's Lackland Air Force Base. They were on board that cruise ship in Japan. Yesterday, a patient in Fort Bend County tested positive. All 3 of these new cases are travel related.
As KXAN's Wes Rapaport shows us, test results for suspected cases in Texas should now come back more quickly.
Texas now has the ability to test for COVID-19.
This is one of the labs where state health officials will test for the coronavirus. There are 10 public health labs in the state's laboratory response network. Governor Greg Abbott says these 6 labs are now able to test for the coronavirus, and the rest will be online by the end of the month.
The state lab can perform approximately tests for 26 patients per day. Houston and El Paso can perform tests for approximately 15 people per day. Dallas and Lubbock can perform tests on approximately 10 patients per day. Once the other public health labs in the state complete the testing validation process and begin testing, the state public health lab network will be able to process more than 125 COVID-19 tests per day.
With an $8 billion package of emergency funding heading from Congress to the president's desk, Abbott says Texas wants as much as possible to pay for testing and treatment costs.
Obviously, the size of Texas, the population base of Texas should qualify Texas for a larger portion of that than some other states.
Across town, the president of the American Medical Association spoke to doctors and nurses at UT Austin's Dell Medical School.
Don't panic, be prepared, look at the science, and get your information from a reputable source, and we say that's your physician.
State health leaders say all Texans can be part of slowing the transmission of the virus.
It's exactly the kind of, again, personal hygiene, cleaning, and sanitation that we've talked about. This is what your doctor and your grandma has been telling you your entire life, and it works.
Wes Rapaport, KXAN News.
State health officials say the risk to Texans remains low, but you should still wash your hands and keep up with good hygiene practices. There's still no positive test results for COVID-19 in our area, but Austin Public Health says that it is still waiting for some results.